Hello, everyone. My name is Dr. Debraj Shome, and I currently run the aesthetic clinics in India. The aesthetic clinics has multiple centers in multiple cities all over India. It is important to declare my financial disclosures. I am a faculty with the Allergan Medical Institute and for MERS, which uses or makes the products which have been used in this particular presentation for the past 15 years. Now, rhinoplasty as we know it is very, very important. And as in this young lady who underwent a pen bomb blast injury, you can have the necessity for multiple fractures to be repaired in the face. And then you have to perform an external rhinoplasty for something as complex as this. And therefore, having surgical skills is very important. Now, in this particular lady, you can sort of see the transformation that was created by multiple surgeries which were performed. And you can see we can give her a new lease of life. So I think there are advantages of knowing surgical rhinoplasty. However, we also, as surgeons, we also have to be aware of the fact that there are more and more people who want repeatable, predictable procedures with zero risk. And surgery, as we know, in the best of hands, can have complications. Therefore, the non-surgical nasal rejuvenation is something that is gaining more and more precedence and preference amongst patients. So a non-surgical nasal rejuvenation is one in which we perform a medical procedure with fillers and with threads in order to fill in the depressed areas, lift the angle of the tip, or smoothen the appearance of bumps on the bridge. Now, initially when we started non-surgical nasal rejuvenation, approximately 5 to 6 years ago, we believed that it was an augmentation procedure. So we believed it could not reduce the size of someone's nose. Obviously, you were putting in fillers, so you were adding material. How then could you do a reduction rhinoplasty? But the truth of the matter is, fillers, when used creatively, can actually appear like permanent makeup and can make noses appear, noses can be made to appear thinner using a combination of fillers and threads. And that's what my presentation is all about. However, there are certain cons, obviously. So it helps if you're a surgeon, especially in the thick skin, which is seen in the South Asian and Asian Indian population. It becomes very difficult to really give decent definition with fillers. Results are better in thinner Caucasian skin. And obviously, the biggest con of using fillers is that even though it's a small 15-minute procedure, it will need repetition every 18 months or so. So our choice of filler typically is the Juvederm Voluma. I like it for its high G prime. I also like it for its fact that it causes a great lifting, it has a great lifting capacity, and it provides good structure. We inject it with a cannula, not a needle, and we'll talk about the blood supply of the nose, which can be very tricky. Anesthetize the nose with prilocaine jelly, which 45 minutes prior to the procedure, and then we perform it in the doctor's office, so this is not done under general anesthesia. The con obviously is it cannot address every type of nasal issue, so surgical rhinoplasty skills are a bonus, of course. And that's the nasal vascular anatomy, and you should understand that most of these blood vessels of the external and the internal carotid actually go ahead and can cause blindness, and therefore one needs to be very, very, very alert while injecting fillers as well. That's how the fillers are injected. Typically, an entry is made with a 21 gauge needle, and that's a 22 gauge cannula which is being used. And we are sort of passing it just supraperiosteally below the nasal mass, and we are laying out the filler just and molding it with the other hand. So the non-dominant hand is sort of molding it. You can also do it from the top, especially for people who have a depressed or a very obtuse nasofrontal angle. It makes it easy to inject it from the top and thereby go ahead and make the nose appear much more symmetrical and structured. There are also possibilities of injecting it in between the lower lateral cartilages and into the septum, and that way you can actually cause the tip to go up. And by getting the tip to go up, you can actually reduce some of the other problems which are there with the dependent nasal tip, especially one which gets accentuated when someone smiles. These are some of our patients, befores and afters, and I'm very cognizant of time, and I've got 10 minutes, and there's so much to say. But a quick round of befores and afters, so you can see how in this particular patient, the nasal bridge now appears much more defined and shows a far better reflection of light. Ultimately, fillers are like permanent makeup, and that's the sort of definition that you can create. Also, when you look at the basal view, you can see that almost horizontal or round nostrils have now been converted into slightly oval or vertically oval nostrils. So you've been able to pull the bridge up in that sense. It's another patient of mine who came in from another surgery, and she actually has a very big prenasal scar. And in patients like these, obviously performing a flap is something that we could do, but it's a complicated procedure. And what she wanted was actually a little bit of filler. After you've done the filler, you can actually find that the nasal scar actually shrinks in size. So you can see how it's become smaller here. And that's because the nose here overall has become better defined, allowing the skin some leeway over the bone and therefore allowing it to contract back into position. She was pretty happy with the results. That's another patient of ours who's had just a nasal filler rhinoplasty, and those are the befores and the afters immediately after. So you can actually see the injection marks which have been left on the nose. Nasal thread lift involves the putting in of cork threads on the nose. And I know that my colleague Constantine has already talked about this as well. But basically, nasal cork threads have corks all the way around, which sort of engage the SMAS and the nasal skin and tend to pull it upwards. That's how the nasal threads are being put in. And that's a 19 gauge cork thread, which is being inserted both from the lower part of the nose near the tip, as well as near the top of the nose at the nasofrontal angle. And that's the procedure. This is a slightly painful procedure, and obviously bless our patient for being so appearing to be so comfortable. But as you can tell, even with the prilocaine and the nerve blocks, the patient does feel this a little bit. But this really adds structure to the nose and causes the nose to appear much tighter and far better than just with the fillers. Now that's our patient, and you can see how her nose looks much narrower. And you can also see how the central dorsum of the nose now has a much better reflection of light. That's the side view, and you can see how the nose looks far better on the side view as opposed to before. That's another profile view. That's the base view. And again, you can see the nostrils, which were more circular, starting to become elliptical. We can also use the non-surgical rhinoplasty for the small humps, as in this patient. You can see how the hump has been layered with the presence of fillers, and then we've also used the cork threads in order to tighten the nose better. Now, some patients will have a drooping nasal tip. So you can see how this patient has a drooping nasal tip, which has been treated with fillers both to the dorsum, then also the fillers to the columella, fillers to the pyriform fossa to sort of raise the pillars or raise the base of the nose, and then threads on the dorsum as well. And you can see the difference that this ends up creating. When the patient is trying to smile before, you can see how the angle was between the nose and the lip. And now you can see how the angle is, even when the patient is smiling, the tip is not drooping down. And that's a non-surgical rhinoplasty. You can also use non-surgical rhinoplasty in other creative ways. So that's a patient of ours who had a very flat nasal dorsum. She came in for a rhinoplasty. You can see how the nostrils are almost horizontal. And in this particular patient, we performed a surgical rhinoplasty. But post the surgical rhinoplasty, whenever she put her hand on this particular dorsum, she would say that it's not as smooth as before, which can happen sometimes post-surgery. We decided to layer the top with a little bit of filler. That's how we've done the filler. This is immediately post the filler, so you can see the bleeding points. And that's how the nose now looks. You can see the external rhinoplasty scar below on the columella, but you can see how the nostrils have become vertically elliptical. So you can use it for a small touch-up post-rhinoplasty surgery as well, instead of going in for another surgery. So in summary, it's a good tool to have, and it's something that everyone should know what to do. But obviously, if you have surgical skills, then you can titrate better, because everything cannot be achieved just by fillers and threads in the nose. And then obviously there are different types of nose. You need to take a systematic diagnostic approach and treat every patient in an individualized manner. We love teaching, and that's one of our training courses just coming up. It's a fellowship in facial aesthetics that we perform at the aesthetic clinics. And we encourage everyone to come and learn some of these skills. And we have dedicated ourselves to a lifetime of teaching. And we hope that there'll be more people who'll take advantage of our courses. I needed to take a minute to talk about one of the sponsors for today's meeting. The sponsor for today's meeting is the QR678 Neo. And as some of you may be aware, This is a formulation derived from a plant base. It's a combination of 6 growth factors and has biomimetic peptides. I was one of the founding team which led to the development of this revolutionary hair formulation. This is administered via mesotherapy to the scalp. There have been 10 plus clinical trials demonstrating efficacy in various hair conditions, which have been published in high impact factor peer-reviewed international journals. Interestingly, in a head-to-head trial, a randomized controlled trial, this was 300% more effective than PRP. This works really well post-hair transplant as well. And this year was a proud moment for us when the QR678 was highlighted as one of the top innovations in IMCAS 2021 and the 5cc Congress. Obviously, this is now being utilized in 10 plus countries at the top skin and hair clinics and with key opinion leaders in these countries. This is also FDA approved in the countries that we are talking about. So thanks to the QR678 team for giving us an educational grant for running this particular educational program. This is a book that we would recommend and request everyone to read. And this is also something which will be given in the gift hampers for the early bird registrations for this particular Congress. This is an anthology which consists of short stories about the doctor-patient relationship. And as doctors, we sometimes face a really tough challenge talking to patients. And there are even instances of violence, physical as well as otherwise, against doctors in various parts of the world. And if you are short on inspiration and you would like to get inspired, read about these 25 doctors in this particular anthology, which has been put together by myself and Dr. Aparna, which talks about all the wonderful things that doctors end up doing and how they are trying to give the human race greater life and energy, especially in this COVID pandemic. I thank you for your kind attention, and thank you once again for having us in between all of you and trying to spread education. Hopefully this talk was interesting for you all. Thank you.